The South African Department of Health is currently undergoing a nationwide serosurvey which aims to determine the status of national immunity. Results thus far have estimated that around 12 million South Africans have already been exposed to the virus without showing symptoms or even knowing they had it. CEO of Direct Retail Goods, Graeme Pienaar, says the antibody rapid test kits they have secured will help in estimating the percentage of people in a population who have antibodies against Covid-19.
Direct Retail Goods has got the license to import Zhejiang Origin Biotech rapid COVID antibody test. A national serosurvey is incredibly important for us to be able to clearly understand how the virus is spread within a community. We've got to understand where this virus has spread, why it's spread, and how do we stop it from happening again in the future. I think the Ministerial Advisory Committee did an incredible job by doing the lockdowns and everything else. But I think with what we could know now, if something like this had to happen again in the future, I think we'd be a lot more capable of handling it a lot better. It's an incredibly easy product to use. It would use a safety lancet, a prick of the finger, 1 drop of blood, which becomes incredibly less invasive. You draw it up through a capillary tube, put it into the test cassette, you add 4 drops of butter solution, and within 2 to 10 minutes, you get your results. This is not a replacement for the PCR. It doesn't detect the virus itself. It detects the antibodies if your body has developed antibodies. I don't believe that the numbers are accurate. Around about 90% of people that are asymptomatic don't get tested in the first place. So the amount of tests that have been conducted is obviously accurate. The amount of people that should have been tested should be far greater than that 4 million number. At the end of the day, if you don't have any of the symptoms, why would you go for a test? The tests are available immediately. So we are in discussions with major pharmacy retailers that we've obviously had accounts with for many years. The problem where it comes with the COVID-19 antibody test is because of it being a Class D medical device, it has to be conducted by a medical professional. It could be conducted by a GP, clinic sister, a pharmacist themselves, but you will not be able to buy the test, go home and test yourself. The medical professional will procure the test directly from us. They will then register on the NHLS's database. Once registered, if you as an end user come in to be tested, the details get uploaded onto the national database. What our appeal is now is it shouldn't be held only in government's hands to do this national serosurvey. If you own a workplace or if you're in management of a big workplace with 100 plus staff members, you can easily get in touch with the likes of Clicks or Discam for them to bring out a clinic sister to your premise and to conduct these tests on your staff. All of those figures and results will form part of the national database that the government is so desperately needing to conduct.